अस्सलाम वालेकुम इय्याका नअबुदु व इय्याका नस्तईन। आज एस के 16 सीरीज़ में मेडिसन 23rd में आफ्टरनून का मैं पेपर करने जा रहा हूँ। तो चलें स्टार्ट करते हैं। क्वेश्चन नंबर 1, ईसीजी शोज़ नॉर्मल पी वेव्स बट वाइड क्यूआरएस, हार्ट रेट इज़ 25, पेस मेकर in Purkinje fibers. Question number 2, the patient developed abdominal tenderness guarding after the fever that is likely cause typhoid with the intestinal perforation. Question number 3, a 20-year-old young boy, Karachi resident brought in the emergency with the fever, headache and vomiting. He is having neck stiffness, altered mental status with the hallucinations. Which among the following is the brain eating parasite, that is Naegleria fowleri? Next, a man swimming in the freshwater pool died after 5 days. What is the likely cause? The Naegleria fowleri again. Question number 5, a patient having the penicillin murmur in the A fibrillation. He is likely suffering from the mitral regurgitation. Question number 6, the clock nucleus root level is alpha T1 L3. Question number 7, during inspiration what decreases, that is the thoracic arterial pressure. Question number 8, drug not given the renal decompensation disease is the gentamicin. To question number 9, the patient having the earache fever and discharge from the ear organism that produce fluorescent pigment and resistant to antibiotic and antiseptic is Pseudomonas. 10, local lymphatic obstruction is caused by the combination of infection of the neoplasia. 11, man standing in the bus suddenly move, man does not fall, how balance is maintained? That is basically due to the utricle. Next, question number 13, the paracetamol poisoning can be reversed with the acetylcysteine. Question number 13, the patient has developed multinodular goiter. This is due to the fluctuating TSH. 14, in obstructive lung disease, which one decreases, that is the FEV1. 15, most abundant cells in the grey matter of the CNS are the protoplasmic astrocytes. Next, question number 16, the blood supply of the pituitary gland is the Charlie internal carotid artery. 17, the patient undergoes kidney transplant. On the first day he was unable to produce urine. There is also tenderness at the transplant site. This is the thrombus at the site of transplant. 18, the fatty diet increase. Which of these, that is CC 19, a 60-year-old man after walking 100 yards presented with the pain in the cough due to which artery claudication, that is the popliteal artery. 20, hormone race in the acute injury is the Charlie. The cortisol patient came in the ER after RTA. The spinal cord, which of the following is seen, that is a spastic paralysis. Next, question number 22, the patient known case of HPV having the cirrhosis, most common cause of secondary hyperaldosteronism is the renin. Next, 23, the patient after thyroidectomy develop harshness of eyes, examination will tense focal curvature. The following is the most likely damage, that is the vocalis. Next, 24, the patient on the antihypertensive having increased urine output is due to the increased hydrostatic pressure, GFR. 25, the 20-year-old boy with rheumatic valvular heart disease has been running a low-grade fever for the last 2 weeks. In addition to a penicillin murmur, he is found to have splenomegaly and the clubbing. The treatment should be injection penicillin plus gentamicin. 26, main objective for the screening test for the cancer is basically early diagnosis. Next, 27, the patient is diagnosed as a case of the pancreatic carcinoma. Family wants to disclose this bad news. The patient who is already dying. What should the doctor do? Tell his brother that it will be dishonesty with the patient family and the medical staff. 28, the low quadrantonopia is due to the lesion in the optic radiations. 29, the patient has anti-HBC IgG positive, anti-HBs negative, anti-HBe negative, HBC and HBe antigen negative. This is the past exposure. 30, a man got headache, anorexia, unwell for the 3-day examination, pale, dehydrated, wasted, lumbar puncture showed the lymphocytosis, protein 85, glucose 65. This is the meningitis, adductor longus. Nerve supply is basically the obturator nerve. 32, the small amount of the blood loss for the longer period of time with low MCV leads to the microcystic hypochromia chromic. Next, 33, the platelet segregation is caused by the thromboxane A2. 34, which drug is safe in the liver decompensation disease? It is oxazepam. Next, 35, the patient of the asthma having the following ABGs, pH 7.23, bicarb 26 and the hypercapnia. Likely acid-base disorder is the respiratory acidosis. Tosalis pedis is the terminal branch of the tibialis posterior. Next, 37, what is the most appropriate way to perform the urine culture? That is basically the alpha option. Next, 38, the adrenal medulla is supplied by delta greater symplectic nerve. 39, the norepinephrine is released by the postganglionic sympathetic nerve fibers. 40, PPD tuberculin test done in a patient after 40 hours. 15 mm erythema is not T cell responsible are the helper T cells. 41, the patient present with a sore throat, membrane coming the throat, removal of membrane, it bleeds, that is diphtheria. 42, meiosis of nerves is caused by the larva fly. 43, which of the following is the confirmatory test for HIV, that is beta the western blot. 44, the the primary immune system organ where T and B lymphocytes are formed and mature is which of the following? The bone marrow and the thymus. 45 after infusion of 0.9 Namaskar. What will occur? Decreased urine osmolality. 46 laceration of the thumb. First node involved will be the infraclavicular. 47 ribosome consists of RNA proteins at which RBC nuclei disappears. This is basically the Charlie, the late normoblast stage. Next 49, at which stage hemoglobin synthesis start? The early normoblast. 50, IgG2 molecule is composed of which of the following? That is E2 gamma chains and 2 kappa L chains. 51, the drug of choice for the cardiogenic shock is Charlie, dopamine, dopamine. 52, the process of the atropine is lost during the carcinogenic activity. The following factor has anti-apoptotic activity, which is the BCL2. Next, which is 53, which of the following is the more aggressive carcinoma? That is the melanoma. Which of the following is locally malignant tumor? That is BCC. 55, the player hiked to mountain having low partial oxygen and developed dyspnea. The likely etiology is the hypoxia. Potent antioxidant is glutathione. Next 57, the child with the blue sclera multiple fractures, his uncle suffered from the same condition. This is osteogenesis imperfecta. A child presents the bleeding of the minor injury. PT 14, APTT 60. Lab shows his factor rate was 7%, factor 9 was 7%. The likely cause is it is Charlie, the Christmas disease. Next 59, the lymphatic drainage of the external noses. Which of the following lymph nodes? The submandibular lymph nodes. 60, the patient has the hemophilia. His two sisters cannot have this disease because it is X-linked recessive. 61, girl has bronchial obstruction, but alveoli are still aerated by the bronchus and don't collapse. This is due to which of the following? That is the alveolar pores. Product of GFR in the plasma concentration of the substance is Charlie, filtration load. 63, the congenital diaphragmatic hernia occurs due to the incomplete pleuroperitoneal membrane. 64, the diminished jaw jerk due to the lesion of that is basically alpha option. 65, for the utilization in energy production, fatty acids from the adipose tissues are transported to the liver, kidney and the muscle as Charlie, free fatty acid bound to the albumin. 66, a boy after injury to the head present with the complaint of the decreased appetite and the lesion on which nucleus of the hypothalamus, that is the lateral. Next 67, anti-aging is by which that is the decreased caloric diet. 68, the patient has emphysema. What will be the acid base imbalance present in him that is raised in the plasma partial pressure of the carbon side? Dead space remained unchanged in shallow breathing. 70, the diabetic patient is having the rhinosinusitis and nasal polyps with the fungus invading lamina papyracea, excessive endothelial damage and having non-septated hyphae organism involved would be the mucor. The patient presented with epistaxis and the menorrhagia. BT 14, APTT 60, PT 15 second, pH normal. Diagnosis is the von Willebrand disease. The patient with the lower backache and the pain radiate to the thigh and the leg and shows the disc herniation. L4, L5, which of the following nerve is compressed? That is the L5. Opening of the mouth is done by the lateral pterygoid muscle. Next 74, left lower lobe differentiated from the right upper lobe by the mediobasal segment. Patient is on the peritoneal dialysis having the potassium 6.1 should be avoided. The tomatoes, which is rich in potassium. 76, the blood supply of the right middle lobe of the lung is beta. The bronchial artery. 77, the barrel shaped chest in the chest X-ray finding is due to the emphysema. 78, the 44-year-old woman is diagnosed with Zollinger-Ellison syndrome. Which of the following is consistent with the diagnosis? The peptic ulcer disease, a known CLD patient presents with the hematemesis resulting from the rupture of the esophageal varices bleeding from which vessel? That is the left gastric vein. 80, most sensitive test for screening of the SLE would be ANA. And 81, the spike in the dome appearance of the pattern on the ECG. What is the cause? That is the patient epilepsy. 82, drug with the short half-life and given in the infusion is Charlie, the dopamine. 83, the patient present with the subcutaneous bleeding, petechiae and ecchymosis with the coagulation profile and CBC normal. The diagnosis is the vasculitis. The patient came in the daycare. He is anxious. Which drug should be given? That's a propranolol. Gene alteration in the CA pancreas is that is beta, which is BRCA2. Mother noticed swelling below height bone in the child presented when he was 3 years old. Since it is increasing, that is a thyroglossal cyst. 87, woman came with the fever, BP 80-60, gram-negative rods were isolated. She goes into shock. What is the mechanism of shock in the UTI? That is the septic UTI, that is septic shock, basically beta option. 88, anterior surface of the heart is formed by the beta right ventricle. 89, the most common site of the atrial myxoma is the left atrium delta option. Next 91, the old age woman with the CVA was bedridden. Suddenly became dyspneic but no such symptoms. After 2 days, she had left-sided pleuritic chest pain, had the CVA and the died. On autopsy, wedge-shaped hemorrhage areas were seen on the left lower lobe. This is due to thromboembolisms. 92, boy fell from the flight stairs, got skull fracture and went unconscious. Blood was in the nape of the neck. This is the damage of the posterior cranial fossa. 93, the factor 8 deficiency will basically cause the hemophilia. Next, a female came back from Thailand with the fever, chills and the body ache. RFTs are D range and low HB TLC and the platelets. This is due to the malaria. Next, a PPD tuberculin test done to the patient after 40 hours. 15 rhythma is noticed. This is the cytokines to the CD4 cells. 96, when do antibodies form in a mother when it's negative and the Rh positive baby, that is antepartum period. 97, the patient presented with the complaint of the cough, hemoptysis, kidney biopsy, how granular deposition of the antigen antibody complex with the C1q is positive and GBM separating. Notice this is related to the delta melanoproliferative glomerulonephritis. Next is the 98, the cholangiocarcinoma is caused by which of the following colonicus sinensis. Next, 99, the treatment of the erythroblastosis fatalis of the beta positive exchange transgene is done with the B negative. 100, which of the following is an autosomal dominant disorder with the tumor mutation, that is a familial adenomatous polyposis. Next, a lengthy scenario where PT and APT are prolonged, it is the DIC. And next, 102, which structure passes superficial transverse carpal ligament, the ulnar nerve. Next, 103, while performing the bronchoscopy, first structure visualized beyond the carina would be that is alpha, which is the upper lobe of the bronchus. Next, 104, the main determinant of the coronary circulation is the Charlie local metabolized and oxygen demand. 105, the patient after trauma, all muscles of the abdomen and chest paralyzed, still breathing, which nerve injury has occurred is the below C5. 106, a group of the mice was taken, injection of the plastic hydrocarbon was given. This will work as initiator in the process. The initiator work as beta, the memory produce. 107, the mechanism of the cancer formation would be the Charlie initiator followed by the promoter. 108, the pap smear done which shows the dysplasia but the base membrane is intact. What is associated with this? There is a carcinoma in situ. 109, the 21-year-old boy diagnosed with the leukemia. He has to undergo the bone marrow biopsy. Patient bone marrow biopsy is taken from which of the following? Alpha sternum. Bone marrow biopsy is done by the ventral iliac crust. 111, an autosomal dominant genetic defect, if phenotypically it is not expressed, the pattern would be the reduced penetrance. 112, the technique used to detect abnormality in the microdeletion the chromosome is the fish technique. Next, 113, the lateral side of the foot is supplied by S1. 114, the patient has the right side hemiplegia, left side division of angle of mouth and dribbling. What will be present? That is the clasp knife rigidity. 115, the woman deliver a baby with a cleft palate and the congenital birth defects. She give a history of taking drug for the acne. The likely risk factor would be the retinoic acid. 116, the female with the fever, sore throat, 60% beta lymphocytes and the beta and T lymphocytes normal percentage in the blood would be the T lymphocytes 80 to 90%, the beta lymphocytes 10 to 20%. Digoxin toxicity is caused by the thiazide diuretic. Next, CSF is absorbed by which of the following? The arachnoid granulations. 119, the non-CLT patient developed edema. The likely mechanism is the decrease in oncotic pressure. 120, the patient present with the bleeding from the post-duodenal ulcer rupture. Which of the following artery is responsible? That is the gastroduodenal artery. Next, 121, hormone causing glycogenolysis and the gluconeogenesis in the liver is secreted from that is alpha, which is the alpha pancreatic cells. Next, 122, which of the following is the white muscle, the gastrocnemius. Next, 123, the subdural hematoma involved which of these? The superior cerebral vein. Next, 124, the fraction of the endosteric volume that is pumped out with each beat is the ejection fraction. 125, the FSH is emptied in the males by the inhibin. 126, the load S1 is seen in the PR interval lower normal limit. 127, third heart sound is due to alpha, the rushing of blood rapidly into the ventricle. 128, the bone remodeling is done by the osteoblast in the class. 129, the corpus luteum secrete mainly the estrogen, progesterone, inhibin. 130, the anterior to the right foot of the right root of the lung is the azygous vein. Next, 131, in the diabetic patient acidosis is due to decreased bicarbonate. 132, 152, a 41-year-old boy came from the Balochistan with the painful legs, ulcers on the leg and the mild jaundice. What is the probable diagnosis? That is a sickle cell anemia. 133, hair on end appearance on the X-ray. What is the next appropriate test for the diagnosis? That is a HB electrophoresis. 134, the tourist after 6 weeks of the returning from the tour came with the fever, general lymphnopathy, and raised typical lymphocytes. That's HIV seroconversion. 135, the patient died had the mitral stenosis and suddenly died after prolonged pulmonary congestion. What will be the variable rich in? That is the heart failure cells. 136, how anterior hypothalamus regulates the temperature. That is gonna be alpha, which is the sweating and the vasodilation. 137, the drug of choice for the cryptococcus meningitis is the amphotericin B. Which of the following is not epithelial tumor? It's Charlie liposarcoma. 139, the diazepam relaxes skeletal muscle by acting on the interneuron. 140, the beriberi is associated with the Charlie lower thiamine. Next, 141, the tongue deviated to the left on the protrusion. What is involved? That is the left hypoglossal. 142, the ovarian carcinoma staging. Which of the following lymph node is affected first? That is the para-aortic lymph nodes. Myasthenia gravis shows which type of hypersensitivity? That is the Charlie type 2 hypersensitivity. Yes, type 2 hypersensitivity. Next, the mural thrombus originate in the Charlie heart. Next, 145, the 45-year-old previously normal lady started having the dyspnea dry cough fever 3 months back, recovered from a month from 1 month when she went on the vacations. Again developed the symptoms when she got back with her canaries. X-ray multinodular lesions in all lung zones. The mechanism of her symptoms was due to the antigen antibody mediated reactions. 146, the following is secreted by the fibroblast. There is a Charlie's amorphous ground substance. 147, surfactant is produced by the type 2 pneumocytes. Terminal bronchioles contain the alpha clara cells. Next, the type 2 diabetic patient has the weakness intense frequency of urine since 2 weeks. What is the possible mechanism of the polyuria? That is Charlie decreased glucose reabsorption from the PCT. 150, that Taylor had the TB infection transmitted to 2 of his family members. Mode of the spread is the aerosolated air droplets. 151, the body cavity divided in the ventral and the dorsal. Which of these is the dorsal? That is going to be alpha cranial. Next, 152, the patient presented with the primary amenorrhea and well-developed secondary sexual characteristic. Patient has the breast but absent uterus. This is basically the paramesonephric duct abnormal development. Next, 153, the liver is held in the upper part of the abdominal cavity by the attachment of the hepatic veins to the inferior vena cava. 154, informed consent is important because it provides the participant with all information regarding the risk, benefits and alternatives. 155, the mass near the porta-hepatic structure damage would be the portal vein. Next, 156, the hypokalemia is due to the gastroenteritis. IV potassium given, how will it absorb sodium potassium pump? Next, a man presented with the generalized body swelling for the 2 weeks. 24, urinary protein was 4 gram. Kidney biopsy, apple color birefringence, fibrin under Congo red stain. That is basically the multiple myeloma. 150, the correct sequence of events for the neutrophil migration towards the site of the acute inflammation. There is the beta margination, rolling adhesion transmigration. And 159, Chagas disease and the congenital megacolon effects. Which layer of the GIT? Delta, the muscularis externa. 160, the highest genetic predisposition is of the type 2 diabetic mellitus. Its correction here. 161, the multiple inactive and the active forms of the which drugs? That is beta diazepam. 162, regarding pulmonary varix opens into the left atrium. So that's all from this section. Thank you for watching my video. Do subscribe my channel until my next video. Allah Hafiz.